Assalamualaikum everyone. For today, we are going to delve into Infertility Decoded Road to Parenthood journey. Let's go!
Good evening. Welcome to tonight's segment where we dive into a topic, infertility. About 1 in 8 couples struggle to have a baby, but thanks to medical advance nowadays, there is more hope than ever for couples who dream of starting a family. Now, let's follow the inspiring journey of Encik Johan and Puan Nora as they go through a journey to become parents. Come in. You sit, okay? Thank you.
Okay, good morning to both of you. I am Dr. Karmila. So, first of all, what brings you here today?
Morning, doctor. My husband and I have tried to conceive for the past 30 months.
Yes, we have been having a regular unprotected intercourse, but we still have not seen the result yet.
Okay, I see. Thank you for sharing that. Okay, may I ask what you both do for a living?
I am a radiological engineer for about 12 years.
Okay, how about you, Puan Nora?
I'm a neurobiologist. I work at a research center.
Thank you for sharing that. Now we will do some tests for Encik Johan, which is semen analysis, and Puan Nora is we will check the uterus and fallopian tubes. Okay?
Sure.
Alright, let's discuss the results. Encik Johan, your sperm count is normal, but we found there is slight problem with your sperm motility. That means the sperm ability to move is lower than ideal.
Oh, I see. Could this be related to my work?
It is possible. Prolonged exposure to radiation can affect sperm quality, including motility. However, this can often be improved with a healthier lifestyle and further precautions at work. As for you, Puan Nora, we found that you have blocked fallopian tubes. This means the egg released during ovulation cannot travel to meet the sperm in the fallopian tubes.
Is that why we haven't been able to conceive?
Yes, exactly. Let me explain how ovulation and fertilization normally work. In a normal cycle, the ovary releases an egg which travels to the fallopian tubes. If sperm is present, fertilization occurs there. The fertilized egg then moves to the uterus for implantation. But in your case, Puan Nora, the blocked fallopian tubes prevent the sperm and egg from meeting.
Okay, given these challenges, I'd like to suggest a fertility treatment plan to help increase the chances of conceiving. There are 2 recommendations basically. For my recommendation 1, I recommend starting with in vitro fertilization, IVF, as the first step. If necessary, we can consider adding intracytoplasmic sperm injection, ICSI, to the process. However, in the recommendation 2, I would like to suggest to perform ICSI directly as the first step. Okay, with that, let me explain how each of these approaches works and how they can assist you both. Okay?
Focusing on recommendation 1, in which starting with IVF as the first step. IVF or in vitro fertilization is a process where eggs and sperm are collected and fertilized in a lab. The fertilized egg, called an embryo, is then placed into the uterus to grow into a pregnancy.
I see. How does IVF help with my sperm motility problem?
We will place your sperm with the eggs in a petri dish inside our lab, and the sperm will swim towards the egg to fertilize them. IVF is a good option when sperm motility is less than ideal. It is still capable of reaching and fertilizing the egg.
I see. So, that helps with my husband's sperm motility issue. But what about my fallopian tube blockage?
For you, Puan Nora, IVF is able to eliminate the need for the fallopian tubes altogether as fertilization takes place outside the body. And we directly place the embryo into the uterus for implantation.
We are interested, but before you go further, can you tell us about the next step about the IVF process?
First, for Puan Nora, you have to take hormone injection called gonadotropin for 8 to 12 days to help your ovaries produce multiple eggs instead of just one. After the egg matures, we will perform the egg retrieval procedure under mild sedation. For Encik Johan, on the day of egg retrieval, you will provide a sperm sample. Since you have a normal sperm count, this will likely be a simple collection. After the eggs are retrieved, we perform the IVF, where we place the sperm and eggs together and allow fertilization to happen naturally. However, if fertilization doesn't happen, we can use ICSI or intracytoplasmic sperm injection, which involves the direct injection of a single healthy sperm into each egg using special tools under a microscope to facilitate fertilization. After fertilization, the embryo will be monitored and cultured until they reach the blastocyst stage. About 16 days after the egg retrieval, you will have a blood pregnancy test. If that is positive, we will do a viability ultrasound around the 7th week of pregnancy to confirm the location of the pregnancy. Or you can go the other way, which is to perform intracytoplasmic sperm injection directly as the first step. ICSI bypass the need for sperm to swim towards and penetrate the egg naturally, in which eliminates your concerns about sperm motility.
What a relief to hear that we can still conceive. But doctor, what about the cost?
For recommendation 1, which is to start with IVF and add ICSI if necessary, this approach is typically more cost-effective initially. This is due to IVF is being used first, making it more affordable option. For recommendation 2, which is to start directly with ICSI, the cost is higher due to specialized equipment and techniques requirement. However, ICSI ensures higher chances of fertilization compared to IVF.
Thank you, Doctor. We feel much more informed and more confident about the next steps.
Yes, thank you for explaining everything clearly. We will update our decision soon.
Okay, I'm glad to hear that. If there is anything, feel free to call my clinic to continue our session soon, yeah?
Yeah, sure. Thank you, Doctor.
As we wrap up today's discussion, both treatments have become increasingly successful, offering hopes for couples facing infertility. The charts show that IVF and ICSI success rates are highest for women under 30, and both rates decrease with age. Thanks for joining us tonight and see you next time.